And a new comprehensive report from United Healthcare is showing the health rankings of all 50 states. It maps out what each state is doing well and areas they could improve in. And on your sides, Ford Sanders is here with us in the studio. And Ford, I know you did a deep dive into this report, so tell us some of the findings for North Carolina.
Julianne, it's called the America's Health Rankings Annual Report, and for the first time, we're now starting to see some of those early pandemic statistics. Now, I spoke with United Healthcare of North Carolina's Chief Medical Officer, and she helped express some of the improvements the state can make.
If you understand at a state level where the opportunities are and then can come together as a community, the hope is that we can work together to improve health outcomes.
A solution many medical professionals are working towards to bring up the health status of Americans. Now, one annual report from United Healthcare is working to show where some of these opportunities can be found.
It's really looking at social factors and access to healthcare factors to understand where are there barriers. And the hope is to bring this to the attention of the overall community so that we can work together with interventions that'll improve people's health.
That's Dr. Michelle Buckner, the Chief Medical Officer for United Healthcare of North Carolina. She says whether it be race, age, income, education, or any other socioeconomic factor, our state needs to improve.
Disparities exist due to race in North Carolina. When you bring up the health of people that have the worst outcomes, you actually improve the health of all.
Saying that there have also been barriers built up, causing adults to avoid that much needed care. So what does all of this mean for Eastern North Carolina?
While Eastern North Carolina may global, as a whole, have significant impacts and significant disparities in rates, the thing you have to realize is that's rural America, right? And rural North Carolina specifically.
Dr. Buckner noting that by addressing some of the disparities and inequities in the eastern part of our state, well, it can benefit the bigger picture.
Look at where the greatest opportunities are that seem to have the greatest impact in health. And we spend a lot of time on food insecurity, but if you look at where we perform low, you can see where, food insecurity specifically could improve those outcomes.
Dr. Buckner also mentions the rate of cancer went down. However, on the flip side, so did screenings. About 23% of adults actually canceled those appointments last year, so the worry is that there actually may be an increased rate of people with undetected or undiagnosed cancer. For now, in the studio, Ford Sanders, 9 on your side.